a government-registered non-profit organization formally established in 2005, October 2nd, on the birth anniversary of the father of our nation, Mahatma Gandhi. Our respected founder, Dr. K Srivastava, inspired by Gandhi's ideology of Gramswaraj, gathered few of the committed followers with a similar vision who came forward to work for the nation building. The concept of Gramswaraj is Gandhiji's brainchild ideology that strongly emphasizes the self-governance of the Indian villages that would eventually contribute to the development of the state. With such a noble vision, SAFE began its work primarily in one of the largest states of Uttar Pradesh of India, with its headquarters located in Gorakhpur city. With an objective to improve the socio-economic and health conditions of the rural community of the region, SAFE undertook the following programs. Firstly, the self-help groups were formed in the rural villages of Gorakhpur and Maharajganj districts. At present, there are 150 self-help groups comprised of 2,500 members, including both the men and women who are actively functioning. All these groups are connected with the local bank called Purvanchal Bank. These groups are occasionally trained with advanced agricultural methods and skill development training such as mobile phone repairing, sewing, and computer literacy skills that would eventually provide them with proper means of livelihood. Eastern Uttar Pradesh is one of the least developed regions in the state, with low literacy rate and high rate of child marriages ranging between 62 to 83%. Raising alarm at the situation, SAFE started its Saving Girl Child program and conducted more than 50 awareness meetings on the issue through the region, sensitizing the community on the ill effects of the practice. In line with the UN Convention on the Rights of the Child to ensure no child marriages before the age of 18, SAFE joined hands with Girls Not Brides and took vows to actively engage with the community and other members of the local, national and global level, including the representation of girls and young people's voices, committed to transparency, accountability and good governance to end child marriage worldwide. In 2015, May, SAFE participated in the Global Partners Meeting to End Child Marriages Worldwide, organized by Girls Not Brides at Casablanca, Morocco. As per annual reports of 2012 on tuberculosis, 1.5 million people in India are affected with the fatal disease, and 277,000 out of them are from the state of Uttar Pradesh alone. Sensing the seriousness of the scenario, SAFE initiated its public health program to eradicate TB from the most prone districts, namely Maharajganj and Gazipur in the state. Till date, through the program, we could train altogether 250 rural healthcare persons on identifying the TB patients, which resulted in 30 to 35% increase in symptomatic referral cases in Gazipur district alone. In both the districts, 48 TB volunteers were engaged in conducting more than 500 community meetings in the rural areas. 50 mass media campaigns were organized, creating awareness about the dreadful disease among the rural communities. At present, through our sincere endeavors, more than 1,000 TB patients are linked with DOTS. Recently, SAFE also unveiled its unique initiative called Safe Blood Bank Project, with its online platform connecting the blood donors with the needy patients. As per the latest statistics, there are 4 lakh street children existing in India who are most vulnerable to various atrocities, seeking shelter on the footpaths, railway stations, bus stops and other public places. In its venture to protect the rights of these underprivileged children, SAFE began its program activities titled as Father Caring Campaigns in 65 villages, sensitizing the rural community on the rights of the children. In addition, the organization also embarked on Railway Children Project, and through this, 362 children from Gorakhpur railway station alone were rescued and handed over to the child welfare authorities of the state for the further action. Child trafficking is another major issue in this Indo-Nepal bordering state, and as per records, every year 135,000 children are trafficked in Indian subcontinent. Through this program till date, 25 trafficked children were successfully rescued. Upholding the right to compulsory education to the children aged below 14 years in the country, SAFE started a pilot survey to assess the basic amenities and facilities in the community schools of the rural villages. Acknowledging the efforts of the organization, United Nations NGO accreditation has issued us special consultative status in the Economic and Social Council in 2014 May. Through our decade-long journey from the inception, the following national and global agencies have been our development partners in our endeavors: the Union Against Tuberculosis and Lung Diseases, Eli Lilly Foundation, Project Akshaya, Paul Hamlin Foundation, Girls Not Brides, Stop TB Partnership, Partnership for TB Control, TB Care and Control, NABARD, Ministry of Environment and Forest of India, National Council of Rural Institute, Grameen Bank, Birla Foundation are some of our partners. Thank you so much for spending time to know about our work, and for more details kindly visit us at our website